My name is Kelly Long, and I'm your Ventura County Supervisor. Today we are at the walk-in site at the Ventura County Fairgrounds in Ventura, California. Very excited. This walk-in site is to do COVID testing for our community. It's a free service that is here to ensure that our community can make sure that they are safe and that they're getting tested for COVID-19. Just on Monday, I went to the Moore Park drive-thru and got my very own COVID-19 testing. It's a PCR test that I went through the drive-thru. I rolled down the window. The person in a mask, I had a mask too, gives me the Q-tip to go through on my nose, and then you put it in a vial, then you give it back to them. It's a very safe process. I've had my two daughters and I go through it as well. And I was able to get a text with the information in regards to my negative COVID testing within 24 hours. We are telling people to use this testing, and you can do it 24 to 48 and you'll get your results. It's a great way to know and to ease anxiety of spreading the COVID-19. And as of right now, if any of you watched our Ventura County Board of Supervisor meeting on Tuesday, we were talking about the fact that there's a risk of going back to the purple tier. And what does that mean? That means restaurants and businesses going back to outdoor versus the small percentage indoor. And I know our public health director will be speaking more about that today. We at Ventura County want to keep our community safe. We want to keep our businesses open, our kids going to school. And to do that, we need all of your help. I know the rules have kind of opened a little bit with Halloween, where it went from keeping to one household to 3. But with this 3 means more people mingling. And so to make sure we're not spreading the COVID-19, it's really important that you do get tested. And if you go to VenturaCountyRecovers.org, there's a test sites, all the test sites that we have for Ventura County, besides the private sector ones. And there are pop-ups. There's so many easy ways to get tested, and it's simple. You'll see it today. And I just ask you, I urge you to please go get tested so that we make sure that that spread doesn't happen. In the news, you've seen it before, where we had H2A housing, where we went from 2 people to 200 people to get COVID. Luckily, they didn't go into the hospital, but everyone got it. So it's really important that we stop it. We don't want people to get transferred to work. We don't want it to transfer to school or even our loved ones at home. So please help us with that. I would like to say I was on the California State Association of Counties conference today, and Gavin Newsom, our California State Governor, was there talking about the same things, about making sure we're taking the precautions that we need, and also thanking everyone for following the California State guidelines for public health on the COVID-19. I appreciate our working with Dr. Galley, Dr. Levin, and all of our county staff. We have over 900 employees that are working for all of you to make sure that we have the safety net associated to help you with this pandemic. So please join in to bond and really make sure we're not spreading this COVID, because I know, like all of us, we do not want it spread. Today we are going to be talking with Rigo Vargas, our public health director, on more of our numbers and what does it mean if we are to go back to purple. We'll be talking with Melissa Barger, our medical director for Ventura County Ambulatory Care. We have Diego, our very own youth that will be tested for Ventura County resident, and Mr. Michael Powers, our CEO for the county, to wrap it up. So again, I really urge all of you to be taking the safe precautions needed. I know it's been 8 months, but it will end if we could just get through. We have a lot of good information coming, but I need our partnership to continue. Thank you to the cities, our state and federal, for funding associated with fighting this pandemic. And for all of you today, stay safe. Be careful, keep healthy, and we will talk soon. We do have another board meeting coming up. We'll see you there, and also track our Facebook, Instagram, all social media. It's both in Spanish and English, and help us by spreading the word as well to make sure that we're getting tested. So with that, I will bring up Rigo Vargas. Thank you very much for tuning in today, and be safe. Thank you.
Good Thursday afternoon, Ventura County. Rigo Vargas, Public Health Director. So as many of you know, while we really appreciate all of Ventura County residents with their dedication, their effort, their sacrifice over the last 8 or so months, by really avoiding gatherings, wearing their mask, and getting tested. Nevertheless, we in Ventura County are not isolated from our colleagues in other counties, other states, and really worldwide, where we're seeing a second wave of surge in cases. And so with that, I think many of you are now familiar that we are in the first week of meeting the purple tier metrics, meaning we have now more than 7 cases per 100,000 resident in Ventura County. That puts us in the purple tier, and officially we would go into that tier next week because the current guidelines by the state is that if you have 2 continuous weeks of meeting the metrics for a different tier, then you are subject to go back, in our case, go back to a more restrictive tier, more restrictive meaning less businesses being able to operate at their capacity. And so while there's some mechanisms built in the state system that could delay that possibility, nevertheless, I want to urge all Ventura County residents to continue to make all that you can do in terms of your efforts, your sacrifice, your dedication to keep yourself, your family members, your neighbors, your colleagues out in the businesses, our students, and our administrators in schools to be able to stay open and do so safely. And so with that, I really, again, the largest number of cases that we're seeing are in gatherings, especially larger gatherings. And so I really urge every Ventura County resident to think twice about the impact of your actions. As I've said before, your actions do matter, and they matter in particular this week because you avoiding large gatherings this week, you getting tested this week, you especially abiding by all the other guidelines, including mask wearing every time that you're around others, those actions will have an impact because that the week of dialogue with the state that we expect to have is with regard to the numbers that end on this Sunday. We might be able to avert or delay some of these closures and impacts if our numbers stabilize, and in fact they could improve with your actions this week. So please continue to get tested. We are seeing outstanding testing going on at this facility at the Ventura County Fairgrounds. Other of our 14 facilities are also seeing an increase in testing. Thank you, Ventura County residents, for rallying and getting tested. But do the other part as well, please. The avoiding of the large gatherings is so critical. Please think about the impact that you're having on businesses from being able to open indoors when you are gathering with a large group. Please think of the impact to children's ability to learn in person with their teachers and their fellow students instead of being in front of a computer. Please do take into account those the real impacts of your actions. And I know many of you have done outstanding work on this, but we just continue to need that excellent continuation of your efforts. So now with today's numbers, today we're reporting 305 new cases in Ventura County. This is over 2 days since yesterday. Due to the holiday, we did not report those numbers. As you can see, on average, that is 150, way over the number that really we were looking forward to, which was moving to the next tier, being the orange tier, where you could have up to 35 cases. We are not only not trending downward, we're nowhere close to meeting that that initial target. So now our next immediate target is to come in below 65. And clearly 150 average of these 305 cases over the last 2 days is in the wrong direction. Please consider helping your fellow, again, neighbors, business owners, and schools and teachers and administrators, students, when you get tested and you avoid these large gatherings in order for us to bring these numbers down. With the 305, we will now have over 15,000, almost 16,000 residents that have had COVID. We have 36 in the hospitals today, so that is a good number. For a while last week, we saw a couple of times getting into the 40s. We're glad the last 3 days we have not had a sustained increase in hospitalizations, but that is a real possibility that our hospital numbers will increase. If the pattern holds of how this virus gets around, first is an increase in cases, then in hospitalizations, then an expected increase in intensive care unit numbers, and eventually an increase in deaths. So let's avoid that from happening and continue to do all that you can to help everyone out. 36 in the hospital, 5 in the ICU. Those numbers are still good. And a word on hospitalizations. We continue in Ventura County to have excellent capacity to treat and deal with hospitalized COVID patients. Our ICU, our bed capacity is excellent. And we continue to push with the state to take into consideration our county and other counties that have excellent hospitalization capacity. Finally, in terms of our numbers, I'm happy to report, though, that today we are not having any new deaths to report. So we stand at 171 Ventura County residents that have had to have the ultimate sacrifice to COVID, and that is their untimely death. 171, but no new deaths today. Actually, one other number, we're at an outstanding testing facility, and the number that we're reporting of newly tested Ventura County residents is 3,718. So a very good number, even though it's over 2 days. Nevertheless, it's a very good number, and we expect that daily test volume to go up because many Ventura County residents are heeding and abiding by our call to get tested so that you know what your results are, but also to help us at the Public Health Department with tracing and contact investigation. And of course, it also can help us adjust our case rate, as that is the built-in mechanism with the state, is if we have excellent testing volume, we do get a positive, favorable adjustment to our case rate. And this week, we just missed it due to not having as big of a case rate adjustment as we had hoped and expected. So with that, I've already said the key things here is don't gather, wear your mask, and get tested. I'd like to now ask Dr. Barger. She is an infectious disease specialist with the Ventura County Medical Center, and she will make some remarks following me. Thank you.
Hi, my name is Dr. Melissa Barger. I'm an infectious disease doctor and the medical director of the infectious disease department at Ventura County Medical Center and Santa Paula Hospital. I just wanted to speak from a healthcare provider's perspective to remind everyone about the importance of ongoing safety during this time in the pandemic. We now realize that this is a marathon, it's not a sprint, and we all are becoming fatigued with this, and we know it can be really tough. But it's really important that we continue to push through with this. This is the new way of life, and we kind of just have to adjust for it for now. However, it is important to remember that this is not going to be forever, right? This is something that we really want to remind you is going to hopefully go away. We don't know when, but it might take a few more months to a year or so, but it's something that we are going to get under control. What we're worried about now is just trying to make sure that we can keep things under control until we get to that point. People are working hard on getting a vaccine, and when there is a vaccine available that is safe, that is going to help us to be able to get over this pandemic. But until now, there's really important things that we need to do to remember about. We have to wear a mask whenever you're going to be around anyone, even when you're outside. You really got to wash your hands with soap and water, use a hand sanitizer. And it's important to know that with the holiday season coming up, there's going to be a lot of people who feel like they're going to be fine. They don't have symptoms, and it's not the time to gather with large families. And this might be a different holiday season. Your Thanksgiving might look different this year, but this is only temporary, you know. Hopefully next year we can go back to having a normal Thanksgiving, or the year after. This is just a short-term thing, and we have to keep that in mind. We've done a really good job as a community in general, and we want to keep it that way when you look at how our county is compared to other counties in the nation. And it's important to remember that. We want to be able to keep our businesses open. We want to have our kids in school. Us healthcare providers, doctors, nurses, we also want those things. We don't want patients to be in the hospital with COVID, because I've seen it. I've seen a lot of patients in the ICU with COVID, and it is not something that you want to have. It's very, very, very difficult, very painful for these patients. Even if they get better, they have long-term issues, and often, you know, it's very debilitating for months. And there are the few cases that don't survive. And this is something that I don't wish on anyone at all. And so it's really important for us to stay healthy, wash your hands, socially distance, and really limit the amount of people that you come in contact with. And even if you have to be around someone, please do it outside and wear a mask and stay at least 6 feet apart from them. Thank you. Up next, we have Diego Batista. He is going to show us something about testing.
Hello, I'm Diego Batista, and I'm 10 years old. I live in the Ventura County residence, and I would like to show you how easy it is to get a COVID-19 test. So, first of all, you get a swab, you rub it in your nose for about a couple seconds each nostril, and then after that, you're gonna put it in a testing tube, send it to, and then you can get your results back in 1 day. It's very quick and easy, and I encourage more kids to do it. Now I would like to invite County Executive Officer Mike Powers up.
Well, good afternoon, and thank you, Diego. Boy, what a great job! He just nailed it. Diego is also one of actually Bautista, our PIO's 4 sons. So really did a great job of demonstrating it. And you know, when we heard the news that Ventura County was on a path now for the state to go back to a more restrictive tier from red to purple, the call went out. Ventura County, we need your help. We need you to get tested. We need everybody to get tested. And you know what? Once again, this county, this Ventura County community answered the call. You can see it. You could see it here yesterday. I was here yesterday. They had a record number of tests here today. 1,122 tests here today. And today, we hear from the manager at the site here, they're exceeding those numbers as well. So Ventura County, you're doing it. You're making a huge difference. And we really appreciate it. And we want you to know that even when it's busy, and it's busy right now, the parking lot's full, there's a bit of a line, it still goes very quickly. It's only about a 10 or 15 minute wait outside. Once you get in, it's just 5 minutes, and as you saw Diego demonstrate, it's a very quick and easy process. And you're getting your results within 12 to 24 hours. So this is a high volume site at the fairgrounds here. We have 3 other high volume sites in the county, remember, at Moore Park, Santa Paula, and Oxnard. And on top of that, we have 9 other locations as well, and you can find those locations on VenturaCountyRecovers.org. So people have also asked, well, how often should I get tested? Rigo Vargas, our public health director, recommends every 2 weeks. So again, everyone should get tested, and every 2 weeks, and at these high volume sites, we can do it. And Ventura County, you're doing it. We really appreciate it. So why does it matter? So it matters from a public health perspective, as we've heard, because we know the virus spreads, and it spreads with people without symptoms, which is really the hardest part of this, right? But this is how we can find it, track it, trace it, and stop it in its tracks. It also matters in terms of the state's system, the way they have the metrics set up now for whether you can reopen. It depends on testing. Testing affects our numbers and our ability to move forward in 2 ways. One is an adjustment factor. We get a favorable adjustment factor. So the case rate that Mr. Vargas mentioned that's too high, that comes down if we have a high testing volume. So it helps with that. But it also helps with the other 2 really important measures, because there's 3. The positivity rate and the equity rate. And the more negative tests that we have, the lower those rates are. And so the more and more testing that we can do, that you're doing, is going to get those rates even lower. The good news right now is those rates are low, and that's a tribute to the work that all of you are doing, but those rates will be even better if we continue to test at the rate that we are. So just so you know, this county, we're plans on multiple fronts. Local level here, getting people tested, messaging, not gathering, and the good guidelines. At the state level, too, we want you to know there's a lot of advocacy going on. Our office is involved. Chair Long is involved, our board members. We're partnering with other counties to advocate on behalf of our community and our businesses here. But let's talk just a little bit about where we're at, because as you heard Mr. Vargas say, we're not heading in a good direction right now, and that's the fact. But there is some hope, and it is that these 2 weeks, if we stay negative for 2 weeks like we are, we'll head into purple. But then we may get a 1-week extension. And that 1-week extension is so important. And we're going to file for adjudication. We're basically going to contest it. And there's also a thing called the Shasta rule. What does that mean? Right now, our tier placement is based on older data, like 7 to 10 days old. What the Shasta rule means is that the State Department of Health Services will look at our current data, our real-time data, to see if the troubling trend is discontinuing, if we're resolving it. So that is our hope. Right now, the direction, we're heading towards purple. But if we're able to, with all the testing that we're doing and following those guidelines, in that 1 week, show the governor, show Dr. Gawley that the problematic trends that we have are trending in a better direction, we might be able to hold on. It's a long shot, but we could do it, and the best way to do it is getting testing. And let's talk about the advocacy and why it matters, too. So sort of how did this happen? Because we were heading in a good direction. Well, our case rate started to go up, even though we had the good other 2 rates. The case rate started to go up. That was about half the problem. And then the way the state measured it changed, right? So that adjustment factor I told you about, they based it on a county-wide average statewide, a county average statewide. And that was at about 239. Well, they readjusted it on Monday. And when they did that, that number went up. The county average went up to about 272. So that meant that we didn't get the adjustment factor that we had hoped. So just to give you a sense, if we had stayed at the previous benchmark that the state was using of 239, we would still be in the red numbers. But because they adjusted it up, because other counties are going up, we didn't get that same factor. This is despite the fact that our county's testing volume has gone up 24% in the last week. Huge increase. And it still went down. So we just want you to know we're advocating with a group of counties, but also directly on behalf of Ventura County. And in fact, on Tuesday during our board meeting, Dr. Levin and Rigo, Mr. Vargas and I spoke directly to Dr. Gawley, and we made this very point to him. It's like, we know you want to incentivize testing. We get it. We're a public health county. We believe in it. But that's what we're doing. We are doing it here, and our community believes in it, and you can see it on our numbers. Even though we increased our testing, we got less credit for it. And I know sometimes unintended consequences happen. So we're going to continue to advocate on multiple levels. We're doing that with Dr. Gawley directly, with a group of counties, with all of our 58 counties, and with our larger urban counties that we're partners with, and to highlight the fact that we also think that the state should use its own benchmark of 150 instead of a floating benchmark. But if they're going to use a floating one, set it and leave it in place so we can all plan around it. Because the other point we want to make is it shouldn't impact our local businesses here. If counties, very fine counties up north, if their testing volume goes way up, that shouldn't make a difference to us here from a public health standpoint or from a business standpoint. So we're advocating, as I say, collectively on that. The other point that we're making, and this is based on data, right? And Dr. Gawley's been very clear. These are public health issues. He's concerned about transmission, and we say we get it. Well, let's look at our tracing data. And we've looked at our tracing data. You heard Mr. Vargas say, where is the transmission coming from? It's coming from gatherings and person to person in household. It is not coming from businesses. So we ask the question, why are these health orders placing most of the burden on businesses? And that's even compounded by the fact that businesses are complying at a really high rate. And as we've talked about before, in Ventura County, based on the state's numbers, our businesses are complying at a rate of 99.9%. So we're saying we get it, but let's not take it out on our businesses. We need to follow the guidance, get tested, wear masks, and so forth. But our businesses are doing the right thing. So we're going to continue to advocate, as I say, individually with the state from Ventura County, but also as part of our overall county networks. So with that, Ventura County, we really appreciate what you're doing. We're standing here at the fairgrounds and we see it playing out. This community cares. You care about the health of our individuals. You care about our businesses. This is what's going to help us, and we really appreciate all that you're doing and we continuing to do. So everyone, please keep doing what you're doing. Ventura County, we can do this, and take care of yourselves. Thank you.